Surgery for intrathecal tumors.
Introduction.
Which of the following is the spinal cord?
Choose one of the following options.
Correct. Which of the following is the dura?
Choose one of the following options.
Correct. The dura is the covering that houses the spinal cord and the fluid that surrounds it. Benign or non-cancerous spinal cord tumors never need surgery.
Select true or false.
Correct. Even tumors that look benign on MRIs could cause paralysis and may need to be taken out surgically. The surgeon always takes out the whole tumor.
Select true or false.
Correct. Using his or her judgment, the surgeon will take out as much of the tumor as is deemed safe. Some tumor may be left behind if the surgeon determines that taking it out will result in more spinal cord damage. Are strokes and heart attacks common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Are infections very common after surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. Paralysis is common after spinal cord tumor surgery.
Select true or false.
Correct. Paralysis, death, and bleeding are not common after spinal cord tumor surgery. However, they could occur, especially if the tumor is big and the patient had symptoms of paralysis before the surgery. A CSF leak is always temporary.
Select true or false.
Correct. If CSF leaks, another operation may be necessary to stop the leak.
Thank you for using Explain.